A good thing about these courses is we can learn how to listen. We can learn how to understand how other people might view the care that we're delivering. And it might be quite a different view than we understand. So for me, I think that's the most important thing. It's about how we can listen, ask questions, and then perhaps modify how we do things, which might not be how we might do them, because that's based on our own background.
Language and culture are important aspects that if we don't include that in new health strategies and in the transformation of Canada's healthcare system, that we are going to miss the boat, and we are going to continue to see the manifestation of poor health in our First Nation communities. So culture will be one of the determinants of health that is so important to be fluid, not just for First Nation people, but throughout Canada's healthcare system. Because there are so many people today that actually utilize the healthcare system right across the country. We're not confined to certain small postage stamps of land or programs and services. That our people, are everywhere throughout Canadian society, in cities, towns, and rural areas, as well as remote. So we have to ensure that culture and language become, the pillar and the principle of a better health outcome for First Nation people in Canada.
There's a real need, and I think there's also a real interest right now in understanding who Canada's Aboriginal peoples are. Oftentimes, though, we fall under the shadow of First Nations, and so there is a real need to do some significant education within Canada's and Ontario's healthcare system around who the Métis are, what our history is, to understand Métis culture and language and traditions, to understand the distinctness of Métis people.
There is truly, to this day, a very indomitable spirit among our people. There is an inner strength and an inner beauty that invariably I've found everybody's drawn to once they experience it. Regardless of the context, regardless of what someone may have come into your office for, and in many cases these will be hard and difficult things, you will almost inevitably find yourself inspired by the strength and the purity and the simplicity behind our people, and the creativity and the ability to adapt and thrive through many of these challenges that you're helping them with. For us as service providers to our own people, there's no greater reward than seeing those positive outcomes. And as we work our way through our challenges, our staff and myself and our board of directors are always buoyed and elated by the success of our people, and reminded of the strength of Inuit on a daily basis by what they overcome and how we've achieved such great things across this country and have a very bright future ahead of us.
To have an understanding of what is respectful engagement, and how to come into a community to honor and respect ceremonies, to be able to learn from the real people on the land doing the ceremonies and to see the outcome of those ceremonies. I think that's what I would call true cultural competency training, and I would invite doctors to come and witness the work that we do.
I would just say on a personal note that many of us, when we went to school, were taught nothing about First Nations, Inuit and Métis peoples. And even younger people that work at CCO we weren't taught it in history, for example. So we all have huge gaps. It's just one of the key ways of overturning these stereotypes and racist notions that arise just truly out of lack of information and ignorance, frankly. And acknowledging the sequelae of colonization. These are our first peoples.